Welcome. This is our first Ask the Vet blog for Ina Road Animal Hospital. Today we have Dr. Liane Lunetta with us. Welcome.
Thank you.
Our topic today is going to be valley fever. Dr. Lunetta, what is valley fever?
Valley fever is a fungal infection of the desert southwest. The areas where this particular disease is most common would be southern Arizona, southern California, most of Nevada, a good portion of New Mexico, and western and central Texas.
Typically, how does a dog become infected with valley fever?
They have to inhale the spores, and the spores live in our soil out here in the non-parasitic form. And once the spores have been inhaled, then in the moist environment of the lung tissue, they are able to become parasitic. They will create spherules and then endospores, and each of those can then in turn create new spherules and endospores, which then will infect the lungs into a pneumonia phase.
Now you said inhale valley fever. Is there any other parts of the body that valley fever can inhabit?
Absolutely. There are multiple places that valley fever can affect. Basically, every body system can eventually be affected by valley fever. In order for that to happen, it has to pass out of the lungs and into the other parts of the body, which is considered disseminated valley fever. Those places often include bone, which is the second most common place that's infected with valley fever, the central nervous system, ocular tissue or the eyes, and the skin.
Now, what symptoms am I looking for if my dog does contract valley fever?
The most common symptom that you're going to see if you get to see the pulmonary or lung form is going to be the coughing dog. They'll often be lethargic, running a bit of a fever. They'll sometimes lose weight, and their appetite will often drop off. Now, certain other symptoms can be seen depending on what body system is affected. So if you have a bone infection, you'll have a lame dog, so they'll often come in limping, or you'll see a swelling in one of the limbs. If it's in the central nervous system, the dog can be seizuring, or have back pain, or other types of neurologic deficits. If it's in the eyes, they could have eye pain or cloudy eyes. So multiple different things to watch for, but usually it's the coughing or limping dog.
Is valley fever contagious to my other animals?
It is not contagious to other animals. However, that being said, in many cases, if an animal lives in a hot spot where valley fever spores are in their yard or in their close environment, multiple animals in the same household could be infected.
So my dog is limping, and I bring it in to you guys. How do you diagnose that it has valley fever?
We're going to do a physical exam. And then we're going to, based off of that physical exam, probably recommend x-rays of the affected area where that animal is limping. And we're probably also going to recommend doing some blood testing. The blood testing is going to include basic chemistry profiles, as well as complete blood count to look at white blood cell counts, as well as a valley fever screen and titer, which is going to give us an antibody level if valley fever is present in that dog's bloodstream.
Now you mentioned x-rays. What are you looking for in an x-ray?
What we're looking for is bony infection, which is going to look kind of fluffy and growing basically outside of what the bone's normal structure would look like. So it can be destructive as well as productive and very painful, and so it will look kind of moth-eaten in some cases.
Now, if I have valley fever, is the titer always going to be positive?
Not always. Valley fever testing is not 100% foolproof. In most cases, if a pet, dog or cat, has valley fever, we're going to have a positive antibody titer. But because it's an antibody titer, it depends on that patient's immune system to make the response.
Now my vet told me that my dog has valley fever, but they gave me a number. What does 1 to 2 mean?
Okay. 1 to 2 is the titer. So it's how many dilutions the laboratory had to do before they couldn't find the valley fever antibodies anymore. So they will do these dilutions and double each dilution until they can no longer find it. So 1 to 2 means that they didn't have to dilute it very far before they couldn't find the valley fever antibodies anymore.
What does that mean for my dog?
Well, it could mean that your dog's only been exposed, and so it created an antibody response to valley fever, and it was able to clear it on its own. However, it could also be either early infection, or your dog just has an immune system that hasn't made a strong response yet.
And if my dog, if it were to go up to 1 to 256, what does that mean?
That typically indicates a pretty severe infection.
Now, once my dog has been diagnosed with valley fever, how is it treated?
At this point, the mainstay of treatment is oral antifungal medication. There are 3 of them that most people have heard of. Nizoral or ketoconazole used to be the medication that we would use. Itraconazole or Sporanox is another one. But what we use these days, most of all, is fluconazole, which is also known as diflucan. If you have a very sick patient who's not responding to any of the oral antifungal medications, there is a fourth medication called amphotericin B that can be administered, but it needs to be administered through a vein in a veterinary setting, and it has many side effects.
Any other supportive treatments available for valley fever at this time?
What we do is try to support that patient's pain, because most of them are painful if it's in the bone. So we will give them anti-inflammatory pain medications or narcotic-like pain medications, nutritional support, and in some cases if they're early on in the infection and not doing well, not drinking or eating on their own, we may hospitalize them briefly just to support their fluid needs and get them feeling well enough to be able to eat and drink on their own and take their medications.
You mentioned hospitalization. What is the fatality rate for valley fever?
It's very rare for an animal to actually die of valley fever, especially once it's been treated. So the majority of patients will actually survive this disease.
Now, when can I stop treatment once I've started one of your antifungals?
We don't recommend stopping treatment without consulting your veterinarian. Most cases, especially if they're uncomplicated, will need to be treated for several months, if not over a year, before we would even consider stopping. The reason for this being the antifungal medications are not fungicidal, which means they don't go in and actually kill the fungus itself. They are fungostatic, which means that they actually slow or inhibit the growth of the fungus. So that patient's immune system still has to get in there and respond and destroy the fungal disease. So we will usually need to treat these cases for a minimum of 12 to 18 months before we would consider stopping the medication. We'll be monitoring what their titers do and how their symptoms are resolving. If we decide to stop the medication, we're going to have that client really watch what that patient is doing and see if their symptoms start to return. And we'll also be rechecking their fungal titers in 2 to 3 months after stopping medication to see if it's starting to rise. If it starts to rise, we're going to restart the patient on the medication.
Now, you mentioned earlier in the blog that we have certain hotspots in Arizona, Southern California. Can valley fever be prevented? Is there a vaccine for it?
I wish there was a vaccine for it, but unfortunately there is not. There is no prevention. There's just trying to deter your pet from getting itself into a situation where it might be more highly exposed. So they are potentially working on a vaccine, but there is nothing available yet. So maybe a few years down the road we might be able to do that. But the best thing that can be done is to avoid allowing your dog to dig or stick its nose in little rodent burrow holes at this point.
Does this mean a strictly indoor dog is likely to not catch valley fever?
No, the valley fever spores can get into your household environment as well. With all the dust we have in this area, it's very easy for it to get into our homes.
Can cats catch valley fever?
Absolutely. It's not as common in cats, and the symptoms that we usually see in cats are not quite the same usually as in dogs. Cats don't often have the pulmonary or lung form or the bone form. They can, but what we usually see in a cat is the chronic draining skin lesion. So they will often get that cutaneous form.
And are they treated the same as dogs?
They are. They do respond quite well to the same oral antifungal medications that dogs take.
Well, thank you for your time. That is our blog today on valley fever. Thank you.
Thank you.